Can you guess what is the leading cause of death in children and adolescents under the age of 19? We bet that you never would have guessed that the answer is brain tumors. Even though brain tumors are considered rare tumors because they account for only 2% of the total percentage of tumors. However, they can have detrimental effects on patients and their families and close friends. Your brain is an extraordinarily complex and sensitive structure where any change in its nature can have significant effects on your body. Brain tumors are abnormal growth of cells in either your brain or your spinal cord. These tumors can either arise directly due to the excessive division of your brain cells, or they could have spread from another organ. In both cases, there are cells in your brain that shouldn't be there. The effects of the tumor mass on your body can vary according to the site of the tumor in your brain, its size, and its rate of growth. However, one thing for sure is that the earlier you detect the brain tumor, the better the prognosis and management of the condition will be. This is why in this video, we will reveal to you 10 silent warning signs of brain tumor you should never ignore. So without further ado, let's get started. Number 1. Persistent headaches. While headaches are common and are even considered normal by some people due to the constant stress in their day-to-day lives. Yet, if they are persistent and worsen over time, they should be evaluated by a doctor. But how can something as simple as a headache indicate a serious condition, such as a brain tumor? Well, your brain is confined in a non-expandable cavity, which is your skull. If you have a brain tumor where extra cells are growing in your brain, this will increase the pressure inside your skull. This pressure is called intracranial pressure. Increased intracranial pressure is the main cause of persistent headaches that accompany brain tumors. This pressure can increase due to the growth of the tumor itself, or it can also increase by the tumor compressing a blood vessel, for example, which would cause the congestion of blood inside your brain. This will also increase the intracranial pressure and therefore increase the headaches. Moreover, your brain is covered by membranes called meninges. These meninges are densely supplied by nerves. Headaches can also be caused by the distension of these meninges due to the growth of the tumor. Number 2. Nausea and vomiting. Even though nausea and vomiting can be caused by less serious conditions, such as food poisoning and motion sickness. However, if they are combined with the other symptoms in this video, they can indicate a brain tumor. Vomiting is induced by the stimulation of an area in your brain, called the vomiting center in your medulla oblongata. The vomiting center can be stimulated by the increased intracranial pressure caused by the brain tumor. In addition to that, the brain tumor can directly compress the vomiting center and directly cause nausea and vomiting. Number 3. Weakness or numbness. Affection of your motor cortex by a brain tumor can cause weakness or numbness to be felt on one side of your body. This is because brain tumors commonly affect only one side of your brain. So, manifestations like weakness and numbness usually affect only one side of your body. Your brain is connected to your muscles through two pathways, a motor pathway which handles movement, and a sensory pathway which is responsible for detecting sensation. If the brain tumor compresses the motor pathway, it will cause a decrease in the strength of your muscle, leading to weakness. On the other hand, if it compresses the sensory pathway, it will lead to a decrease in sensation, which will be felt as numbness. In most cases, both pathways are affected, leading to weakness and numbness. Number 4. Changes in personality or behavior. Have those around you commented on changes in your personality or increased mood swings lately? If your answer is yes, then you better check with your doctor because this can indicate the presence of a brain tumor. Your frontal lobe and limbic system are two areas in your brain responsible for regulating your emotions. If any of them is affected by a brain tumor, it could cause changes in your personality. You could notice increased irritability, mood swings, or changed social behavioral patterns. The imbalance of brain chemicals due to chemicals produced by brain tumor cells can cause anxiety, depression, or even psychosis. Number 5. Changes in sensation. Tingling, numbness, or a feeling of pins and needles are examples of how brain tumor patients describe changes in their sensation. There are two tracts responsible for transmitting main sensations from your body to your brain. The first one is the spinothalamic tract, which is responsible for transmitting pain and temperature sensations. The second one is the dorsal column medial lemniscus pathway, which transmits information about body position, vibration, and fine touch sensations. Compression of any of these tracts can affect how the person perceives sensation. For example, compression of the spinothalamic tract can affect how the person perceives pain and temperature. While this can sound like a superpower for a 10-year-old kid, however, this is extremely dangerous. If you can't feel pain and hot objects, then you are more likely to be injured by them. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 6. Vision changes. Blurred vision, double vision, or loss of peripheral vision can be signs of a brain tumor, especially if these changes occur suddenly or worsen over time. The eyes are the window to the brain is a common saying in medicine. Basically, this means that problems in your eye can indicate an ongoing problem in your brain. Normally, we can see because our eyes transfer information about the light in our surrounding environment to our brain through the optic nerve. The brain uses this information to form the images that we see. However, if the optic nerve was compressed by the growing brain tumor, it will affect our vision. This is because the brain will no longer receive information from the eye. Number 7. Balance and coordination problems. Difficulty with balance, coordination, or walking may reflect a problem with the cerebellum or other brain areas affected by a tumor. The cerebellum is an area at the back of your brain responsible for coordinating your voluntary movements and maintaining your balance. If your cerebellum is affected by a brain tumor, then your movements will be consequently affected. Number 8. Seizures. If you find yourself having seizures and you've never had them before, this could be a sign pointing to an existing brain tumor. Seizures are sudden changes in your behavior, movements, consciousness, and sensations due to changes in the electricity of your brain. As the brain tumors grow, they can irritate the part of the brain they are growing in. This irritation leads to abnormal electrical activities in that area. Furthermore, growing brain tumors can affect the arrangement of nerves inside your brain. As the connections between your nerves are disturbed, the transfer of electrical impulses between them is also disturbed. This disturbance manifests in your body as seizures. Additionally, the origin of this brain tumor is from your brain. Then these extra brain cells can release extra chemicals inside your brain. Your brain's chemicals are normally responsible for stimulating or inhibiting electrical impulses inside your brain. Changes in the balance of these chemicals will change the balance of your brain electricity, which can lead to seizures. Number 9. Difficulty speaking or understanding speech. Have you been having a challenging time finding words to express yourself? Did you recently start experiencing slurred speech or having difficulty understanding others? All these signs raise the suspicion that a brain tumor is affecting language areas of your brain. Broca's and Wernicke's areas are two areas in the brain involved in language processing. Broca's area is found in your frontal lobe, and it helps you form proper sentences and use language to express yourself. In the temporal lobe, you will find Wernicke's area, which allows you to understand language, whether it is written or spoken. If they are compressed either directly by the tumor mass or indirectly by the increased intracranial pressure, they can affect your understanding and usage of language. Number 10. Memory problems. Memory problems or confusion may be a symptom of a brain tumor. Compression of areas responsible for creating and storing memories in your brain can damage the nerves in them. This leads to either the inability to create new memories or the inability to recall old memories. Some patients may experience both. There are many types of memory problems which differ according to the area of your brain that is impacted by the tumor. There you have it. These were the 10 silent warning signs of brain tumor you should never ignore. So, have you or someone you know been previously diagnosed with a brain tumor? What were the symptoms felt leading up to the diagnosis? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.